This is Dr. Latasha McElwain providing a PowerPoint on secondary trauma and secondary trauma stress. This is for the purpose of supervision, and this is to help clinicians, professionals, individuals working in the mental health field understand what secondary trauma is and how they can cope and things they can do to help prevent and things they can do to help themselves in regards to dealing with secondary trauma. What is secondary trauma? So secondary trauma is natural consequence that of the behavior and emotions that basically is often a result of a form knowing about a traumatizing event experience by another. So basically knowing that this event has happened to someone else and you have heard the story, you are starting to feel different things that are happening or different things that are, occurring based on what you've heard from, possibly a client or another person that you're dealing with. As far as being in the mental health field, we do hear a lot of interesting stories. Some of the stories are very traumatic. Some of the stories have a lot going on, and there are a lot of different nuances and different pieces to it. So we do tend to hear a lot on a daily basis when we're doing outpatient services or even providing services in crisis situations. If you work in an emergency room or you work in any other crisis, mobile crisis type scenario, you'll hear a lot of different stories. So the term secondary trauma stress basically is a result of the stress from helping and wanting to help persons who have been traumatized, or they're definitely suffering with probably what has happened to them. So mental health professionals are at high risk. That is something that, we as mental health professionals hear a lot of, and substance abuse professionals, we hear a lot of the traumatic events that have happened in people's lives, and it's a lot that goes on. It is an occupational hazard for us, and we start to feel, we start to have those feelings that are similar to what the clients are experiencing or have experienced based on the fact that we're hearing all of it. As we're working together, we start to, feel some of those things that they're sharing with us. So we got to be mindful of that. So I do tell people, okay, if you're in a scenario where you're hearing a lot of trauma, and a lot of our trauma focused therapists that come through, talking to them about making sure that they're able to understand their level of secondary trauma. A vicarious trauma is another one that we use, just to make sure that they're, up for it and understand what it takes from them to be this strong trauma therapist. And if they're unable to do it, or there are some things in there that we notice, a lot of times we have supervision conversations about those things to try to help them gain more confidence, not only gain more confidence, encouraging them to get more education also. So moving right along, according to the Office of Victims of Crime, basically, secondary trauma stress refers to natural consequent behavior and emotions that often result from knowing about a traumatizing event experienced by another, and the stress resulting from helping or wanting to help a traumatized or suffering person. So that's their words that we actually kind of switched up earlier, but that is what they refer to it as. And we want to use that definition because that's a really good definition, and it gives us a good breakdown of what secondary traumatic stress is. All right. So what are ways to identify secondary traumatic stress? So looking at Dr. Perron from Northwest University, he highlights these potential signs, and I really like those signs, so I wanted to use them here. He said that when we're talking about secondary trauma stress, it is related to uh, comp when we're talking about compassion fatigue. He also wanted to, let us make sure that we understood too that there's some vicarious trauma that goes along with that. So we take on people's trauma. So compassion fatigue is when you're hearing a lot, you're doing a lot, you get real tired, but you're kind of just pushing through regardless. And then we look at vicarious trauma, hearing everything, and we still kind of getting the brunt of it from basically secondary, pretty much. We didn't experience it, but when the situation was explained to us, we kind of start to have some of those concerns. So some of the things that do come up when we are showing signs um, could be hypervigilance, could be dealing with some being just more aware, a heightened awareness, nightmares, kind of having different things on your mind, and then kind of end up dreaming about those things and cause nightmare type situations. Change in the sleeping habit, change in appetite, new fears and anxieties come about that are kind of triggered from knowing or hearing these stories. um, Another one is loss of pleasure. Somatic conditions, meaning some medical, physical conditions can come about. I do tell people sometimes that, when you're in stressful situations or hearing stressful things all the time, I think people always think about the ulcers in your stomach. But yeah, things can come about, or having those migraine headaches. So that those are things to think about. And then the inability to work. So sometimes things are so that you're hearing is so traumatic, or I would say the consistency of hearing traumatic things. If you're a trauma focused therapist, then yes, there's a lot there, and there's a lot that needs to be, thought about as far as, okay, how can I make sure that I am taking care of myself so I can take care of my patients? All right, ways to handle secondary trauma stress. And this one came from SAMHSA. Basically, ways that you can think about handling the stress or handling the secondary trauma stress is getting support from your fellow peers, also seeking out supervision or consultation, making sure that you are reviewing things and that you are able to make some good clinical decisions, good clinical judgments. I like to say place things where they need to be placed. I call them compartments. You guys have heard me say that before. But yeah, placing things in compartments so that you can be able to move on and continue to do your job. Setting boundaries. You definitely have to set boundaries. We always talk about that. Considering furthering your training. So having more training in the area. Maybe you need a little bit more background on this, that, or the other when it comes down to a clinical topic or a situation that has happened, that you're just not quite aware of what happens there. I have experienced something like that when we're talking about, and it wasn't necessarily trauma. Well, it was trauma for the individual I was working with. But when you think about it, I don't come from a culture or a part of the US where siblings tend to be together for the most part in relationship type scenarios. But when working with a family that did come from a area like that, a state like that, um in the culture in that area was kind of like that, where if you're not dating someone else, you're dating your brother or you're dating your family member or something like that. So that was something that was really interesting for me, but that was very traumatic for the patient I was working with. So with that being said, I had to go back and start reading up on things like that so I could be more educated about that culture, and where within, not within, well, within that particular culture, what they do, the background, everything else. I had to just read up on that so I could be more understanding to what was going on and what was a norm, what wasn't a norm for them, and what they did to make sure that I was educated. So further training in certain areas, even if the areas is kind of a little bit like off clinical side, like what I'm stating now, you want to have a little background. You definitely want to have some background. And then sometimes not a little, you want to have a lot. Because in that scenario, I did get a lot of background information to understand, that way of life, to understand that lifestyle, to understand that culture, to understand what they did in order to, continue living in, in what the thoughts were and all that other stuff. So yeah, definitely something that was interesting. So considering that, further training in the area, um, consider your own therapist. So getting your assistance and your help, talking things out with someone else that, when you're working with other individuals, as a therapist, you are getting a lot of information, and a lot of this information gets so, kind of pushed in and pushed at us, or whatever the case may be. And we hear it and we understand, but sometimes it could actually flare up things within you. So, with that being said, a lot of times that's why we consider, you know, encouraging anyone working in the human services profession to go ahead and consider having your own therapist on standby, because there are a lot of things that can come up and a lot of things you may have to readjust yourself in order to be able to deal with certain things. Getting enough sleep, getting enough rest, making sure that you're taking care of yourself. Be active, kind of get out and do some things, whether it be physical exercise, whether it be walks, whether it be, get out with friends, because we're going to get down to that in a minute, connecting with loved ones and family, and eating healthy, whether it's going out to have a good lunch, or having, changing up your diet maybe a little bit, where you're eating less, salty, sugary foods, to a little bit more salads and, the Mediterranean diet, things like that, just to help boost you up as much as possible, as far as being able to handle some of the stress and some of the things that come your way. And sometimes I tell people, I didn't realize this until being in this field for almost 17, 18 years now. I've realized now, I think when I first started in this field, the 20 something years that I've been in this area, those earlier years, I didn't know anything about self care, because I was in criminal justice doing all this, helping people and doing things like that. And I didn't realize how much self care was a big component of making sure I'm taking care of myself, until I came into counseling and then kind of experienced a level of burnout or level of stress, vicarious stress, I'm sure, vicarious trauma, I'm sure. But experiencing all this stuff is what's gotten me to the point of really changing and making a full lifestyle change. And, that came about for me in about 2017, 2018. I made a total lifestyle change. And then that's when, sleeping became a priority, eating healthier became a priority, being active became a priority. And I'll say being active really became a priority almost 2 years ago now. So, I tell people all the time that you have to kind of fluctuate and adjust and figure out what's going to work for you. So I say that to say, if you are a crisis counselor, if you're dealing with, in counseling in general, and you're hearing a lot of traumatic stories and different things of that nature, you got to take care of yourself. Definitely. All right. I'm going to move on here. And we're going to talk about some of the self-care strategies for crisis counselors. This one's coming from Samsa as well. So when we're talking about self-care strategies, we'll look at focusing on 4 core components of resilience. So we want to look at adequate sleep, healthy eating, regular physical activity, and then active relaxation. So create a self-care plan could be something that people do. I know I have done so. So creating a self-care plan that have those components would be amazing, to help you start to figure out how you're going to navigate through a lot of the situations and different things that come along with compassion fatigue and secondary traumatic stress, and just feeling a whole lot there. So you want to definitely take care of yourself. Developing positive relationships with other crisis counselors. That would be a great one, because you'll be able to celebrate successes and mourn sorrows as a team, pretty much. Ask a coworker to be a self-care buddy, and plan to attend regular group check-ins. So having someone to check self-care buddy and then be able to talk about what you're doing to take care of yourself is a major thing, and it really does help. I know that for certain. I kind of, self-care buddy with my my sons that work and help me in this field. And those are things that we do, talk about. We check in and make sure everyone's, hey, did you work out today? Did you go by the pool today? Did you go for a walk today? Did you lift weights today? Things like that. Did you ride your bike today? We talk about things like that, and they'll ask me, hey, did you get a dance class in? So All right. And then moving on to schedule time for relaxation, meditation, and rest. So you got to take the time. You got to take the time. And you have to, because you definitely want to be able to put yourself in a place where you can take breaks, you can take time away from work, you can definitely, if you need to just calm and you have something that happens that's just a major issue or whatever the case may be, you want to be able to schedule time to relax, schedule time to meditate, time to rest. You want to be able to take advantage of all these things, practice your deep breathing, any other stress management techniques that you regularly do or you can do. I'll share one of mine. One of my things is, even though I work 12-hour shifts, I go for I call it a meditative walk. And I do it about 3 times during my 12-hour shift. So it's about a 15 to 20-minute walk around the building. I'll walk around the building, sidewalk to sidewalk, all the way around. And after I get that walk in, normally I probably walk at least a mile within that 15, 20 minutes or so. But I try to get them in, at least 3 of them a day, to keep me going, because I always tell people, when you're working a 12-hour shift, that doesn't, you don't really know how many patients you'll see in a 12-hour shift, which you may end up seeing a lot, or you may end up seeing very few or a little. But just regardless of what, I break my day up where I take my walks around the building to take my break. Another thing I do is I definitely focus on bringing some, taking that time to have my lunch away from the workstation, so I can really, have that moment to relax, that moment to breathe, that moment to take a little bit of a rest, a little bit of a break. Um, I do tend to, if things get too much for me at work, I do take a 15-minute, or take some downtime where I will go in for meditation. I will meditate at work. So I can say I do take breaks, and I do try to, manage my stress levels and things like that. Um, and then another thing you can also do is stay in regular contact with friends and family, of course, your loved ones. And then you want to also stay informed on resources and events for crisis counselors, because there are a lot of self-help groups out there, special groups out there that help individuals that deal with a lot of, especially since COVID, I would say this, we realized how wild it was for the frontline workers. Not that it wasn't wild before, but it was wild during COVID. And it's probably really a lot of people who didn't really take a break during COVID, like didn't take some time off, or wasn't, placed off from work or anything like that. They really worked all the way through, afraid and all. So that's a lot to think about when we're talking about compassion fatigue. We're talking about secondary trauma. The stories we heard during COVID also were very hard. We're still hearing those stories because people lost a lot of family members and things like that. Some families were almost completely wiped out except one person, and that one person is there to tell us the story. So yeah, there's a lot that go on there. So we have to really take care of ourselves. The next one is another strategy. This one also comes from SAMHSA as well, strategies for supervisors and team leads. So to focus on the 4 core components of resilience, adequate sleep, healthy eating, regular physical exercise, or physical activity, active relaxation, and creating that self plan, of course. Again, developing a positive relationship with other crisis counselors, of course, celebrating the successes and mourning sorrows as a team, and then co-worker, the buddy system again, scheduling relaxation. So it's pretty much the same thing, but it's definitely pushing it towards the supervisors and the team leads, because these are things that I feel, as being in a supervisory role or team lead type role, I feel like I should be pushing these things for my individuals that are working with me, for me, on my team, or I need to be pushing it also in my life also. So not, or I guess it'd be, and I need to be pushing it in my own life. So I need to make sure that I'm good, you're good, and we all can be good. So I think that's real important to say. The next part is prevention of secondary trauma. When we talk about prevention of secondary trauma, a lot to go into that as well. We're talking about from a professional standpoint, we want to look at staying balanced with our caseload. So we want to talk about our caseload. We want to meet with our supervisor and say, hey, this is a lot. This is what's going on. Either I'm not able to keep up, or I'm gonna need to take a little bit of a breather so I can catch up, and whatever it is I need to do. Having access to supervision. So being able to talk things over, being able to, run things over and pass and get some more good clinical judgment, some good clinical feedback. Creating downtime to release in a safe physical space. So time to what we say, woosah, time to do just that, just to take a breath and blow it all out for a second. And you're in a safe place to do that. I know many large organizations and some small ones as well have a calming room now. That's a big thing that's happening where people are actually able to go into the calming room. The calming room might be where people can actually meditate for a little bit. People can actually take a 5 or 10 minute nap. I think they have a alarm thing where it'll wake them up if they decide to do that. But you would be amazed at probably how refreshing one of those rooms might be, because they're usually real calm, real quiet, and it gives you that feeling of, okay, I can pull myself together now and go back and do what I need to do. So yeah, creating that downtime to release. Personal strategies, respect your own limits. So respect your own limits. We have one in there, but respect your own limits. Make sure you're respecting the fact that I at the top of what I can deal with, and right now my limit, I've passed my limit. I can't. Yeah, you have to really say those things and respect the fact that you are at the top of your limit, and you can't take any more. Maintaining time for self-care. Make sure you keep that time in focus and that time in mind, that you are going to take 30 minutes to an hour to take care of yourself right before work or right after work or whatever the case may be. You're going to take care of yourself. You're going to implement something from your self-care plan, and you're going to put it in there. And then you're going to be pretty happy that you did it. Seek connections and self-nurturing. So yes, seek out connections with other individuals, different departments, different areas. Self-nurturing. Make sure that you're nurturing yourself. If you're feeling certain ways, it's okay. Like I tell people sometimes, it's okay to have had a hard day, and it's okay to come home from work and say, hey, it's a 6 o'clock night for me. I'll be in bed by 6:30. You have to think about those things, and you can plan for it. I tend to have a lot of my, not only supervisees, clinicians I work with, and the patients I work with do something I call sleep hygiene. And with sleep hygiene, they basically take 1 or 2 nights out of the week. Usually I tell them 2 or 3 if they can, but definitely stealing away 1 or 2 nights a week to have it I call our early night. And so what I encourage them to do is take an early night. I do it myself. So I don't I tell people all the time, I don't really practice and don't I practice what I preach. So what I do is what I, encourage, because it helps me. But at least 1 or 2 nights a week, I call those my early nights. And that will be a night where I will be in bed by 6. I'm not asleep by 6, but the goal is for me to be in bed by 6. The latest would be 7. And the goal would be that I am asleep by 7 p.m. If I get into bed at 6, if I get into bed at 7, I am asleep by 8 p.m. And I sleep the entire night. And that's to rejuvenate myself. And that's to make me feel more fresh, make me get up the next day and do what I have to do. Me, I'm a person that needs 10 to 12 hours of sleep, or would like to have 10 to 12 hours of sleep to feel fully alert the next day. Some people can do it on 6 hours. Some people can do it on 8 hours. I say that to say some people can do it on 8 hours, but they're only getting 4 every night. Some people can do it on 6 hours, but they're only getting 3 hours of sleep every night. Give yourself that self-nurturing and being able to say 1 or 2 nights a week, I am going to take advantage of all my sleep, and I'm going to bed for the 6 hours, the 8 hours, the 10 or 12 hours that I know I need in order to be refreshed and feel recovered. So preventions for secondary trauma, a lot there to think about, but definitely good things I think that people can put in place. So clinical consequences. Now, when we're talking about secondary trauma, some of these things start to spiral a little bit. So we want to talk about what can happen. Professionals can basically have big adverse effects on the patients based when they're dealing with a lot of the secondary trauma. Stress, because, at sometimes, it might cause some disruption. It might cause some issues in the therapeutic alliance. It may also cause some situations where boundaries are being violated. Professionals also can become overwhelmed and be more avoidant to, hearing some of those experiences the patients are typically trying to share. Also, professionals might also be pushing the patient to move too quickly through things in efforts to, basically master their own responses. But you have to be able to hear a person out and not rush them through their process of healing. And that's what we're doing normally. So, want to be mindful of that. Development of compassion fatigue. So, sometimes that happens as well. We end up developing compassion fatigue, and that puts us in a whole different mindset, and it's definitely not clinically advised to be in any of these areas, because all of these areas typically will end up leading to something that will go back to what we talked about earlier in the year with violating our code of ethics and what we say we're going to do and what we pretty much take that oath and say we're going to do. Okay. All right. So a lot of this good information definitely came from the Family Institute at Northwestern University. Dr. Nate Harrell is one of the clinical assistant professors and one of the core faculty members at the university. And I want to quote what he said here. Anytime that counselors express empathy, we are not just using a counseling skill of empathy, but we are actually engaging in the experience of our personhood. So that speaks volumes to me, because that gives us a lot. I'm glad that the good doctor was able to have that information in one of the articles I read. But this way here, really says a lot, because we are engaging in the experience, of our personhood as being people, and what happens and what could happen, and things of that nature. So I really like what he said, so I wanted to put that in there so you guys could just hear it and know it. Okay, so here's some resources for secondary trauma stress. And a lot of these resources are talking about things to give yourself a self-assessment, be able to look at, because you served traumatized kids or traumatized families and communities that have been traumatized. You're working with, you're a healthcare worker, and there's so many different things out there to kind of help you to manage, when you're dealing with victims, screenings, podcasts, and other materials in the workforce to help children and families addressing child abuse and trauma. There's also some stuff here that talks about research and training and practitioners basically advocating with the goal to advance the field of secondary trauma, stress towards health. There's also toolkit fact sheet and guide here. A lot of it I thought was real good information that talks about what is STS, secondary trauma stress, and then talking along the lines of information and intervention strategies, talking also about professional organizations for counselors, definitely dealing with that vicarious trauma piece. Because vicarious trauma is something, like I said, that we realize happens, but a lot of us don't realize like it's happening and when it's happening, all this other good stuff. But it is stuff that do affect us, and we have to be aware of it, and we have to raise the awareness of it as well. So these are some good resources and information in here. Now, going into the reference here. So with all the information we have given, we have done a great job on just really going over what is secondary trauma. And I will say, with going over this information, I find that talking about secondary trauma is major, because I hate to say it, sometimes we don't talk about it as much. There are some new researchers coming about it. I saw a whole lot of stuff, and I just pulled a little bit from here and there. But There is more research being done about secondary traumas, and I think that is wonderful. That is great, especially for the mental health profession, substance abuse profession, domestic violence counselors, all of us in doing the work that we do in human services. We have to be mindful of secondary trauma. So I'm glad that you guys are here to hear what I'm saying, and I pray that a lot of you look at some of the resources and some of the information and go back and pull some other stuff that's going to help you. It's going to be something that's going to give you a little bit more insight, and it's going to give you a good idea of how you must take care of yourself. Self care is very important. I tell everyone that I think COVID brought that out for all of us. But we really have to take the time to smell the roses. We have to take the time to water the plants. We have to take the time to take a walk and breathe. We have to take the time, not only take the time, but make the time and take the time to go to the park after work or before work or on the weekend or whatever the case may be, to take a deep breath and just have a moment, or just lay back and relax in the backyard, at the pool, in your bathtub, in your bed, just really taking care of yourself so that you can help prevent as much of the secondary trauma that is coming your way, that has come your way in the past, and that will continue to come as long as you're working in this field, because that's one of our occupational hazards, again, like I stated earlier. So I thank you guys for joining us and joining me again. This is Dr. Latasha McElwain. Have a great one.